Yes, sir.
Great.
Hi, are we waiting for a little longer?
No, sir, we can start the event.
Okay. Go ahead, Harini.
Yeah. Thank you, sir. Good evening, everyone. I'm extremely happy to welcome you all to join us for this amazing panel discussion on LGBTQ plus inclusion in society, including the healthcare.
Recording in progress.
I am Harini Raj, General Secretary of Agam Tagore Unit. For those of you who are all not aware, Agam is an organization formed by medical students, uniting medical students all over Tamil Nadu. I'm sure everyone here wants to be a better LGBTQ plus inclusive healthcare provider in the future, but not many of us know how exactly to go forward with it. Well, at the end of today's discussion, I'm sure you will be enlightened on that. So without further ado, let me introduce you all to our amazing and successful panelists for today. To start with, let me introduce you all to our amazing moderator of today's session, the Vice President of 𝗏𝗏, a national NGO and a volunteer of Orina. His interest towards public health and his continuous work in inclusive development of communities marginalized based on gender, sexuality, and conditions such as HIV and TB continues to inspire us young minds. Please welcome Dr. 𝗪𝗏𝗏. Thank you so much for joining with us today, sir.
Thank you.
Next up, I'm extremely proud to introduce you all to Kerala's first transgender Ayurvedic practitioner. Reading her story of coming out with all the challenges and struggles she faced as a child fills me with this confidence that nothing in this world is impossible. I'm sure her story is a true inspiration for many kids out there who are struggling to come out themselves. She has regularly been involved in raising awareness of LGBTQ issues to mainstream audiences. Please welcome Dr. Priya. It is our immense pleasure to have you with us today, ma'am. Thank you for joining with us. Next, we have Mr. Alex Murugabupathi. He is an IT consultant and proudly out as gay to his family and at the workplace. He volunteers for numerous LGBT activities such as Chennai Pride March, Chennai International Queer Film Festival, and LGBTQ plus peer support meetings of Orina. He has supported in various LGBTQ sensitization events. Welcome and thank you so much for joining with us today, sir.
Thank you.
Next on list, we have a mental health counselor. He works for Emotion and Me, providing online counseling through telephones, emails, and chat-based apps. He also volunteers as peer counselor with Orina. Please welcome Mr. 𝗀𝗏𝗃, sir. Thank you so much for joining with us, sir.
Thank you.
And finally with us, we have an intersectional queer, a feminist researcher, and an advocacy professional. She works at the intersection of gender, sexuality, and technology. Please welcome Brinda Lakshmi, ma'am. Thank you so much for being with us here today, ma'am.
Hi, I'm Brinda, and my pronouns are they and them. Please don't address me as ma'am. Call me Brinda. Thank you.
Sure. Sorry, ma'am. Sorry. And finally, we have a mental health counselor. Yeah. Next, I'll pass it over to our amazing moderator, Dr. Ramakrishnan, who will take forward this session from here. Thank you, sir.
Thank you very much, Harini, and your colleagues at Agam. And it's great that you all are hosting this event to coincide with Pride Month. So, am I audible?
Yes, sir. Yes, sir. You're complete.
Okay, I'm going to turn off my video in case there's a problem. So, the way we would like to do this is as follows. We will have a couple of rounds of questions and answers with the panelists, where I will be asking some questions to elicit some insights from them. And then we'd like to do a little bit of a 101 on, key LGBTIQ issues that are relevant to healthcare. And then we can come back for another round of discussion. Okay, so I am going to begin with Dr. V.S. Priya, whom you already have introduced. Priya, are you there? Is your audio working? If you get your video on. Yeah.
Hello, am I audible?
Yes, you are, Dr.
Yes.
Priya. Thank you for joining us in the middle of all your work. And we'd like to start off with you telling us a little bit about your experiences growing up, especially during school and college, so that other people who are also from the community, might derive inspiration from, how you've managed to succeed professionally, educationally. So we'd love to hear from you, Dr. Priya. Please go ahead.
A warm good evening to all. Hope I'm audible.
Yes.
Yeah. Okay. I'm Dr. Priya V.S. From Thrissur, Kerala. I completed my graduation in 2009 in BAMS and post-graduation MD in 2012. And I started practicing from since then. And currently I'm working as consultant physician in Sitaram Ayurvedic Specialty Hospital, Thrissur. So coming back to your question, yeah, yes, being a queer child, being a trans girl, I faced many challenges during my childhood than ever before. Like that was the phase of my life, the most hardship-filled phase of my life, because I had to face almost in every scenarios of life. I had to face discriminations, being a queer child. So growing up as a trans kid or a queer child was not easy, like any others in this country, and that too before 20 years. So it was like, even my family and I myself was not aware of the terms queer, transgender, gender identity, sexual orientation, or whatever. I was not aware of that. And as everybody know, childhood is a phase like everyone is studying everything new regarding life. So we will be doubtful regarding every aspects of life, and we will be constantly asking our doubts to our parents, our friends, whoever are around with us. So but in this case, I didn't know whom to ask, whom to consult, and what to ask even, because I was confused about my identity itself. So I knew like I am different from other kids of my same age, but I didn't know what the difference was. I knew I am a girl within, but everybody else around me is considering me to be a boy. And even when I look into the mirror, I totally see a different person. I see a totally different person. So I was like so much frustrated, and uh, yeah, adding upon this thing, the discriminations that I faced from my friends, from my school, from the society, everything was building upon that frustration. And it was like, when we go to a place, even for that instance, when we go for classes, every classmates used to mock me, keep on bullying me. And it was all like uh, creating deep trauma or wound in my heart. And it was like, when I look back into my school days, they are like one of the most uh, tragic times of my life. So but now it's like, okay, now I am like used to, now everything is changed. But during the school life, it was very hard for me. And my parents took me to, obviously they took me to a psychiatrist, thinking that I am having some serious mental illness. Unfortunately, that psychiatrist was a sensible person, and he didn't. Fortunately, he didn't give me any treatments or medicaments. He told my parents like, I'm a normal child. No issues with this kid. No need of worrying about him. He called me him, but even he was not aware of this queer identity. But then at least he had that humane aspect. So I was saved, and I'm right now here in front of all of you as Dr. Priya. So and after that, after my school days, during my entrance, when I was preparing for my medical entrance, I prepared myself also. Like, I wanted to be unnoticed. I wanted to be like a normal student. So I thought of like, hiding my identity and my mannerisms. And to an extent, I was successful. When I prepared for my medical entrance, I prepared for this aspect also. I started controlling my mannerisms, everything, and I behaved as a boy, or I behaved as a male student when I joined my professional college. And there things were more easier for me. I didn't face any challenges. I didn't face any mockeries. I didn't face any bullying. I was like a normal student, along with others. Nobody noticed me. I had friends. Nobody had any problems making friends with me. So my college life was like very, soothing for me, like comparing that with school days. And I was like into, and during the college life, fortunately, I opted this medical stream. And I started to learn about myself, about the gender identity, sexual orientation, and all, the basic concepts of psychiatry and all. I started learning in my college days, and it was like an eye opener for me. I started building up confidence, but I was, very much afraid of the society. Like everybody else, every people around us, I was also afraid about the society. I was also afraid of coming out, because I feared that I would lose this liberty, I would lose this independence, I'd lose the, since I'm constantly comparing my horrible life, school life, with this free college life. I was very much afraid of revealing myself. So I kept on hiding my identity. I kept on masking my identity as a male, and I behaved as a male, and I completed my college life. It was all like a normal kind of kid. I was a normal college student then. And after my college life, when I started my career, things were different. I had more time to concentrate on myself. I had more time to concentrate on what I wanted. So I researched upon. See, I was like I was more of an introvert kind, and I didn't have good enough friend circle in the queer community also. So I had to depend on the internet for my research. So I started researching upon everything, how the transition works, how should I socialize, how should I convince my family and friends, and even my workspace. So I did my research for two to 3 years. And after concluding my research, I was confident enough to come out to my parents. I first came out to my mother, and she was obviously she was shocked, and I expected that, but I gave her enough time to overcome that shock, and then she recovered after, like maybe 2 to 3 weeks. She recovered, and then we started conversing, a healthy conversation regarding gender identity, sexual orientation, what phase I am right now, what all challenges I am facing, everything what all knowledge I acquired during my research. I presented it in a convincing way to my mom, and she was convinced, and she came to a point that she was confident about me. And then she told me, like, move forward, forward, and I'll be with you in whatever troubles you face. Don't worry, I'll be with you. And that was the word I wanted. And the next day I started my hormone replacement therapy. I was my psychological counseling was all over. I just wanted the consent of my family, and my mom allowed that. And the very next day I started my HRT, and things went smooth because I just wanted my family support, the workspace, my friends, my colleagues, everybody. I used to sensitize in between. I used to discuss with them. I used to talk with them about this matter. Regardless of that, I think, being a medical student during my college days, I conducted a research myself regarding, gender identity and sexual orientation. What is the status of medical students regarding the awareness of gender sensitization? So, but to my shock, that days, maybe it is like 10 years back, people was least aware of all those things. Even medical students were not bothered about that. I, being a queer child, I being a trans woman, I took my own interest and I researched about this. but medical students were not aware of this, whether it be Ayurveda or MBBS or BHMS or whatever. I have good friends from all streams. So it was like I talked with all of them, and to my I was really down after knowing this thing, that nobody is aware of their social responsibility to how to treat a queer friend or a queer child around them. So regarding that, that was my experience being a queer child and a medical student. So I think we have more panelists. I'm not taking much time. We'll continue the discussion and we'll talk about this later. Thank you.
Thank you very much, Dr. Priya, for sharing your narrative. I'm sure we'll come back to you. Now we'll move to Alex Murugabupathi, who was born and raised in the Andaman and Nicobar Islands and then studied in Kerala and in Tamil Nadu. So Alex, how was your experience growing up gay and being through multiple education institutions, including professional institutions? Please share with us. Thank you, Alex.
First of all, good evening, everyone. And thanks for this opportunity, Ramki, to share my story. In my childhood, I have to say that it was challenging. It is very much similar to what Priya has endured in his childhood. Till 5th standard, there was no problem. After the secondary level, the mannerism, the way I spoke, it was a little bit different from what the regular boys used to do. I was more comfortable with girls. I was having more friends from girls. Girls were more comfortable talking to me. But I was constantly bullied by guys. It was very much challenging. To top it, I have to say that the teachers, they liked me. I was studious. I used to study a lot. They used to tell me that you have to behave like a boy. I don't know how to behave like a boy. I can behave like myself, right? And to top it, the boys, most of the boys used to bully me. They used to call me names also. And the only consolation which I had in my school days were the girls. They were very nice to me. One of the things which I realized, right, I was actually attracted to guys in my school days. Most of them were bullies also. They used to bully me constantly, but I was attracted to guys. I thought that I may be a transgender. Till school days, I was assuming that I'm transgender because that was the word which was, the boys used to call me regularly. Then came college. The things which I have, I have experienced in my school days. I was very careful not to show those things in my college days. I was very careful because, in college, the crowd will be more matured and I need to be, I need to safeguard myself in whatever way possible. And to top it, I have to say that I studied in Tiruvanaanthapuram, Government Engineering College, Tiruvanaanthapuram, and language gap was there, I have to say that, it was difficult for me to pick up Malayalam in initial days. Maybe that is one of the reasons. But I have to say that in Kerala, if you are speaking in a feminist way or something like that, people will accept. I don't know. I was accepted in my college days, the way I was speaking. It continued, I have to say. And one more thing which I realized in my, in Kerala is the terms LGBTQ. Till now, I was thinking that I was transgender. But, the first movie which I saw in my college days, because that was like a revolutionary period. It's we have a SFI cell there. I don't want to go in detail, but the first movie which I saw was Fire. That was the time I realized that I am gay. I am attracted to guys, and I'm comfortable with my gender, and I'm not. I am different. There is no doubt about it. When you are comparing with the heteronormativity in this society, I'm thankful to the college days, I have to say, where I get to know about the terminology LGBTQ. Then I did my post-graduation in Chennai. More information, I have to say. The information which I got in Thiruvananthapuram, I was bombarded with more information in Chennai. I started researching about what LGBTQ is. The college days were in Chennai was also comfortable, because I have to say that in my college days, nobody bullied me. In both in Thiruvananthapuram or in Chennai, I was never bullied. I don't know what is the reason. I was socializing. I have to say that I was socializing with everyone, but the bullying didn't happen in my college days. Then I joined a IT company. The financial independence, the financial independence plays a great role for an individual. You start making decision in your life. Till the age of 30, it is fine, because after the age of 30, you will get a lot of pressure from your parents. After 30, it is like you will not get married. You will not be marriageable. It's like it's difficult for the parents to get their son or daughter to get married. I have to say that I was not able to take a decision, because in my childhood, I have to say that I was supported by girls. They have been strong in my life. They have supported me irrespective of the way I was bullied by guys. The very thought of getting married to a girl and spoil that girl's life was like a toughest thing for me. I was not ready for it. I don't want to hurt anybody in my life. I cannot even hurt an insect. I cannot kill an insect. But I'm getting married to a girl. Definitely she's going to find it out. It's not the very next day she is going to find out that I'm different. So I took the courage. I took a decision. I was suicidal because it was too much to take. I was very much suicidal. I took the decision that I have to take the decision now itself. I went to a counselor. I told, I don't want to hurt anybody in my life. If a girl comes in my life, definitely she's going to find it out. She's going to be hurt. And my family will be hurt, and that girl's family is going to be hurt. It's not fair to anybody. To that girl, I said. Then my counselor told me one thing. You always think about others. What about your life? What you have been doing is you're hurting yourself. And that was like, okay. I was like thinking about the society. I started thinking about myself. Okay, I'm doing huge injustice to myself. I should not hurt myself. I need to love myself the way I should be, right? That day I came out to my brother, and he was supportive. I was surprised because I never expected this from my brother, elder brother. He said that, okay, whatever you are saying makes sense. Marriage is off the table. I will make sure that you are not getting married to a girl. And the very next day, I told my parents also, see, I cannot get married to a girl. I'm different. My sexuality is gay. I'm attracted to guys. What more I can say? You cannot do this injustice to that girl. And to be honest, I don't want to hurt myself by getting married to a girl. And I became more bold, I have to say, after meeting more, LGBT or LGBT community people. I got to know more about the LGBT community in Chennai. I started to know more about the LGBT community, which is very good thing, I have to say, in my life. And I started being more open in my office also. There are sensitization programs which happen in office, and I'm happy about whatever is happening right now. So that's all about it, Ram.
Thank you, Alex. I'm sure we'll have a chance to hear more about your experiences in the workplace. But for now, we will move to Brinda. Hi, Brinda. So we've heard so far from Dr. Priya, who identified herself as a trans woman, but also used the term queer sometimes. We've heard from Alex, who identifies himself as a gay man, but also went through certain struggles where he thought that he may actually have been trans and then discovered that was not the case. Would you, as a researcher and a professional who works on issues of gender and sexuality and technology, and someone who identifies as gender non-binary yourself, be able to share with our audience in sort of simple terms, what is sexual orientation, what is gender identity, and how gender and sex actually differ from each other? So maybe you can start with sex and build your way to gender identity, and then sexual orientation. Please go ahead, and thank you, Brinda.
Thanks, Ramki. I hope you can all hear me. Yeah. So as medical students, I would think I think you would understand the biology of sex. I mean, the sex of a child when a child is born is determined based on the baby's sexual organs, hormones. Based on this, the doctor defines or determines that this is the sex of the child. Usually the sex is assigned as male or female. There's also a child may also be intersex. I'm not getting into that aspect here right now, but usually children are babies are assigned either as male or female based on their sex organs, their hormones, chromosomes, etc. Now gender is based on social, it's socially, it's a social construct. Gender is a social construct based on a person's behavior, self-identification, how they experience themselves, right? So a person may identify with the gender of their sex assigned at birth. Say a person who is assigned female at birth and identifies themselves as a girl or a woman would be cisgender. So they're assigned a certain sex at birth and they identify with the gender of that sex, right? So same way a person who is assigned male at birth and identifies as a boy and a man would be a cisgender man. So now what if a person is assigned male or female at birth? Let's say, okay, female at birth, right? Like myself, I was assigned female sex at birth, but my gender identity, I don't identify myself as a woman. I identify myself as a gender non-binary person, which is I don't identify myself as either a woman or a man, right? You might also ask, okay, so you don't identify yourself as a woman, but then you're dressed so effeminately, you're wearing a sari, you're wearing makeup, like, what is that, right? That is my gender expression, right? My gender identity is non-binary, but I can choose to express my gender any way I want. I have had short hair for a very long time in my life. I've had long hair. I mean, hair, the way I dress, the clothes, that doesn't say much about my gender identity. That is just my gender expression, right? A person may be assigned male at birth, right? And may identify themselves as a woman, right? A person may be assigned female at birth and they may also identify themselves as male, right? So gender is a spectrum. That is, you can identify cisgender as what you're assigned at birth, or you can, on the opposite end of the spectrum, identify the opposite of what you were assigned at birth. Or you might also be non-binary like me, gender fluid, agender. So there are many different gender identities that are there. So this is the distinction between sex and gender identity, right? So now what is sexual orientation then? Sexual orientation is who I am attracted to, right? Like for instance, my gender identity is non-binary and I identify myself as pansexual. I, in short, say I'm queer, right? But if you ask me, I'm pansexual, for me, the gender of the person does not matter, right? That's my sexual orientation. A person may be attracted to someone of their own gender or their opposite gender. When it is opposite, we call them heterosexual, right? Which is what, generally in the society, they say a cisgender man is supposed to be attracted to a cisgender woman. That's what they call heterosexual, being heterosexual. And we are all expected to be heterosexual. But it is not the case. All of us are not heterosexual. And again, just like gender, sexuality is also a spectrum. There are some people who are attracted to opposite gender, some people who are attracted to the same gender, right? And when it is a woman who is attracted to someone of their own gender, they're called lesbian, or they may identify themselves as queer women, right? And when someone is attracted to like two genders, right, they're called bisexual. When, like myself, a person may identify or be attracted to people of many genders, or they might not see any distinction, and they may identify themselves as queer or pansexual the way I do. So it's a spectrum per se, right? And going back to what happened at the beginning of this session, if you remember, I stopped Harini and said, my pronouns are they and them, please don't call me ma'am, right? That is also the gendered language, right? Oftentimes, so it's important to ask for a person's pronoun, which is why I put my pronoun down next to my name. And as medical professionals, I would think it's very important, when you're going to be looking at patients, without coming off as being non-queer or affirmative, because queer people are often discriminated and looked at or seen as different, right? So if you really want to be inclusive of queer people, please ask for their pronouns, right? And don't take for granted their gender expression to mean their gender identity, right? Like a person may dress a certain way, but might identify themselves differently. So this is just a quick overview for you on sex, gender, sexuality. I hope that wasn't confusing and was clear enough. I'm guessing we'll get around to talking more about it in a bit. Ramki, if there's anything that you think I missed, please feel free to add.
Yeah, thanks, Brinda. No, that's great. And you reminded me to enter my pronouns also. So yes, so now we'll move to 𝗏𝗏𝗃. 𝗏𝗏𝗃, as someone who has provided mental health support to the LGBTQ community, both as a trained professional with a master's in psychotherapy, but also as a peer, as a member of the community, what are some of the typical issues you have encountered, and you can choose to bring in your personal life or your professional work as a counselor? Go ahead, 𝗏𝗏𝗃. Thank you.
Okay, thank you, Ramki. So here's the thing, when it comes to my personal journey, it's been, usually people do talk about what are the things that they have gone through and what are the things that they've experienced, like bullying and harassment and whatnot. It's a constant struggle, like from the beginning, from childhood to adolescence to adulthood. We face many mental health issues because the kind of the way we were brought up. You should be a certain way, you should look a certain way, you should walk a certain way, you should talk a certain way if you're a cis man or a cis woman. So this was something that was tricky, and it I wasn't able to understand at that point of time, because I thought, okay, fine, we should be this way or else we'll be punished, or else we will not be accepted in the society. So that will have an impact on our mental health, like throughout our life, the kind of stress that we have to go through, because the pressure and the kind of expectations that the society have on us is like, you should be the successful person, you should live a life where you should be an example. That is the constant pressure that a person goes through, and when we start being ourselves, things change. So generally, this is the kind of issues that I faced, and after, doing counseling and psychotherapy, I started, talking to my clients about this. They have also gone through a similar road, but there are like different stories and the process is different. We cannot say that everyone has gone through the similar story, but, we can relate to it because the kind of pressure that we had. So the general stuff like depression, stress, and PTSD, that is the kind of common things that I've come across when it comes to people in the queer community. They have they always, they want to talk about stuff, and when they start sharing their stories. So these are all the things that the things that they've gone through. For an example, family violence, and that will lead to lack of acceptance, the pressure to marry, and violence from peers and partners, and institutional violence from workplace and in schools. All these will have an impact on it. So
explain PTSD just to be safe. Yeah.
Okay, post-traumatic stress disorder. So if a person has gone through, series of stress or something, it will have an impact on them after experiencing the trauma. So yeah, this is something that is common in the community. So people do want to talk about the basic issues like, coming out. Coming out is something that is very, that is something common in the community. Like, they kind of tell to the people they love, for an example, their parents, about their sexual orientation, or, like their gender identity and stuff like that. They will share that to the world and their loved ones. So that is a very tricky part because they always want to be accepted and loved. And when you say that you're being different from the usual, from the general population, they have a lot of questions, and they are scared to lose their loved ones. So they want to talk about that, and relationship with the parents, relationship with their partners. This will have an impact on their relationship with their partners as well, because it's like a chain reaction. In the beginning, they will always have this low self-esteem, saying that, okay, fine, this is what I'm going through, so I should be a certain way. And they will always have this thought, okay, fine, this person is not going to accept me, and they will have trust issues and loads of that. So they want to talk about this as well. And relationship with the community and friends, people inside the community, when it comes, if they want to talk about someone in the community, or if they want to connect with someone in the community, they have their own set of issues, like when it comes to making friends, because from a very small age, since childhood, they will start experiencing all these. And most of the people, they go through this alone, because it's not something that is common where they can share with others. So that is something that is very important. They find it difficult to make friends or to socialize. So the main thing that I will that I have recommended is the support groups, which can be very useful for young adults, where they can share about stuff, and they can feel at home, and they can make friends and socialize. So yeah, these are all some of the things. And other questions like sexual health. Sexual health is something that is super important. The STDs and the risk related to STDs, they have lots of questions regarding that. So yeah, let's start.
Thank you very much, 𝗂𝗏𝗃, and Brinda and Alex and Dr. Priya. Now, before we get to the next round of sharing, I would like to speak a little bit about some of the work we have done relating to medical education. And I am going to share a few slides. Not all the slides, don't worry, those who've seen this before. Yeah. So Brinda has already given an overview of basics of gender and sexuality. I just wanted to quickly take a moment to introduce the two groups here that are happy to be partnering with Agam. Sati is an NGO where I work. It's a national NGO. It works across the country, headquartered in Chennai. And we initially, as the name suggests, solidarity in action against the HIV infection in India, started with a focus on HIV treatment and making treatment accessible. Over the years, we have expanded to look at how can we strengthen and how can we expand access to stigma-free health, justice, and social welfare services for marginalized communities. So we work with LGBT communities, we work with prisoners, we work with rural women, we work with pregnant women who are living with HIV, we work with pediatric TB, we work with transgender communities that have TB, etc., etc. And in this program, we are very delighted to be partnering with Orinum. Orinum is an all-volunteer, unregistered collective composed of LGBTIQA people and allies based out of Chennai, Tamil Nadu. Orinum was established almost 17, 18 years ago. It functions as a support, cultural and activist space. Both Alex as well as 𝗂𝗏𝗃 spoke about support group meetings. So there are monthly support group meetings being organized, and there's also individual peer counseling available through individuals like 𝗂𝗏𝗃. Also, there are, if people need professional referrals to mental health professionals, or maybe a gender affirmative therapist or an endocrinologist, or a surgeon for, transgender folks who want gender affirmative procedures, we refer them. There are also film festivals and literary event sensitization workshops being conducted. And Orinum is also one of the co-organizers, along with Sati, of Pride, which happens in Chennai, which has been happening since 2009. Last couple of years, we did not have an offline Pride march because of COVID. Okay, so now I'm going to quickly skip to the healthcare part. So there was a research carried out about 6 years ago with medical students and interns regarding their knowledge about homosexuality and attitude to homosexuality. And they basically found that those who had had some exposure to LGBTIQ people, or had had some understanding of the community apart from what they learned in their medical textbooks, were more likely to have a positive response and much more likely to be willing to provide affirming care to members of the community. This was a study done in Ahmedabad in Gujarat. So this got us wondering, what do our textbooks really say? And those of us who are MBBS students or MD students have probably encountered stuff in your textbooks that you didn't actually stop and connect with the entire LGBTIQ community. So maybe it's time to do so. So what we did, when I say we, I mean Sati, in collaboration with Dr. Sameera Jahagirdar, who is an anesthesiologist and a professor at Mahatma Gandhi Medical College in Pondicherry, and also a trans woman herself, looked at a whole bunch of UG and PG textbooks across disciplines like medicine, psychiatry, gynecology, pediatrics, urology, forensic, dermatology and venereology, endocrinology, etc. And also conducted interviews with faculty as well as students. So what's in blue here are the books we looked at. So for example, in medicine, we looked at Munjal textbook of medicine, Golwala and Golwala medicine for students. We looked at Ahuja and Bhatia psychiatry. We looked at 3 Shaw's textbook, Datta as well as Virkud in gynecology, couple of books in pediatrics, couple in dermatology, 3 in forensic, 1 in surgery, 1 in urology, 1 in endocrinology. And here's an example of what we found. This is from a textbook in forensic medicine, which is right now in its 37th edition. And this is what it says. It has a section on sexual offenses, which itself is offensive, because we are not really talking about sexual offenses. We are talking about consensual relationships among adults. But anyway, what the textbook says is that female homosexuality is known as tribadism or lesbianism. Many lesbians are masculine in type, possibly because of endocrine disturbances, and are indifferent towards individuals of opposite sex. The practice is usually indulged in by women who are mental degenerates or those who suffer from nymphomania, excessive sexual desire. Lesbians who are morbidly jealous of one another, when rejected, may commit homicide, suicide, or both. Let's take a minute for this to sink in. Imagine a student who is lesbian herself, with a lot of struggle and preparation, has joined her MBBS course. And this is what she learns about what she is supposedly like. Can you imagine the impact it will have on her sense of self, her her self-esteem, her identity. And also imagine the 99 other people, the 99% of other people who are not lesbian. This is the attitude that they will inculcate, they will cultivate from learning what's in the books. It gets worse. A lot of people have talked about psychiatry so far. Now, if you look at 𝗵𝒶�プ𝗃, which is one of the standard short textbooks of psychiatry, they say things like transsexuals. Transsexuals is actually an old term for transgender people who have undergone gender-affirming surgery. And they say that transgenders may also have a high degree of concomitant psychiatric disorders. The point is that people who have worked with the trans community for years and years have found that most of the psychiatric disorders, if any, are disorders that are problems that arise from society's lack of acceptance of their identities. Also, this old and unethical and unscientific practice called conversion therapy, about which 𝗂𝗏𝗃 will speak later, where people, parents take their children to doctors, especially psychiatrists, and psychiatrists say that, okay, your child is gay, I will try to quote unquote cure your child, or your child is transgender, I'll make your child cisgender. And they give electroshock and aversive condition and all of these other quote unquote therapies. This is still there in recent textbooks. So the problem is partly that the textbooks may be reprinted, but they haven't actually been updated with some of the developments in international, some of the international developments in science and medicine. For example, in 1990 itself, the World Health Organization removed homosexuality from its list of disorders in DSM. And more recently, in 2019, the World Health Organization replaced the term gender identity disorder with gender incongruence for trans people, with the recognition and the accumulation of data over decades, suggesting that these are not illnesses, and that if people are provided a supportive environment, they can survive and flourish and do just as well as everybody else and not have the mental health issues that are associated with stress. If you look at Shaw's textbook of gynecology in the 𝗵𝒶𝒃𝗃 and 𝗵𝒃 2014 edition, we see terms like homosexuality, transvestism, and transsexuality are abnormal sexual behaviors. So this list goes on. I did not present the entire list of textbooks and analysis that we have done. But if you look at, for example, pediatrics, there are entire chapters on adolescence and sexual development and development of sexual attraction and secondary sex characteristics. And there's no mention of same-sex attraction or transgender identity in some of the reputed books even. But I'm going to leave you here with a couple of thoughts, is that you heard a lot of terms. You may find a little bit that this is confusing, but we can always share more information in case you're interested in the future. But one important thing to not do is don't make assumptions about people's sexual orientation or gender identity or sex characteristics based on their gender expression. So sexual orientation, again, as Brinda said, is who one is attracted to. Gender identity is what one identifies in terms of gender, which may or may not be the same as the gender corresponding to sex. And sex characteristics refer to the secondary and primary sex characteristics, which in the case of intersex people may differ from the male-female binary. But to translate this in simple language, if you see a male who is behaving in a way that you think is feminine, don't automatically assume that the person is gay or the person is, you know, pre-transition or anything like that. Because if you do so, very likely the questions you ask may be misleading. The kinds of conclusions you draw may also be misleading. Most young cis women going to a gynecologist will be asked questions like, are you married? And this is the doctor's way of eliciting information on whether she is having sex or not. Now, there's so many problems with this assumption that only if she's married will she be having sex. Secondly, that all women only have sex in the context of heterosexual marriage. You know, there are several issues with this that you need to let go of assumptions. Be aware that the medical research community, as I mentioned in the case of WHO with ICD, is increasingly recognizing that sexual orientation and gender identity are not pathologies. The other issue to remember is that if a trans person wants to actually undergo hormone therapy or surgery, as long as they are 18 or above, you don't need to ask them to bring their parents. And I say this because very often in the Indian context, even if the individual is like 25 or 30, they say bring your parents. And they do this especially for trans men, that are people who are assigned female at birth who identify as men. And it just goes into reflecting the biases that the medical profession has about female born people and making decisions on their own. Yeah, so these are some of the problems. If there's some time later today, I will play you a small video on how and how not to take patient history. But I'm just going to close this part with a recommendation that when we talk about healthcare, we need to be talking about quality of care, making sure that the care is clinically competent, affirms the identity of the client. So one integral part of good quality care, or even minimum standards of care, is that they should be minority friendly, including LGBTIQA friendly. For this, we need to change the medical curriculum. For the people who've already graduated from medical college, we need to have CMEs where we speak about this kind of information that they may not have had in their college. I've looked on the Agam YouTube channel that you have already a lot of really excellent videos on various anatomy topics, etc. It would be good to actually have some content on gender and sexuality for people to do self-study. And it's always good that this kind of sensitizing of healthcare providers should be done with the involvement of people from the community, as we are doing today. So with this, I'm going to stop my presentation and take us over again to Dr. Priya. So Priya, would you be able to share a little bit about what was there or what was not there in the Ayurveda curriculum containing sexuality, about sexuality and gender identity? Anything was there?
Okay.
Yeah, you have to unmute. Yeah.
Yeah. Okay. Yeah. Actually, in our Ayurvedic curriculum, we do go through both the Ayurvedic part as well as the modern part. So almost all the textbooks are similar for both MBBS and Ayurvedic context. We actually do some more research in Ayurvedic terms. That's the only difference. In my experience, I would say, like, since I was a trans woman and I knew at least some basics about that, I was aware of the things that were told in the medical textbooks. During those days, as 𝗵𝗵𝗶𝗃 told, there is a requirement, a terrible requirement to reconduct, seminars and discussions for the people who already passed MBBS or whatever medical streams. They need to unlearn some things that they learned in their curriculum, and they need to relearn the real facts that are approved now. So it's like, even I had some, experiences, bitter experiences from my seniors, and from even a surgeon, one of my friend. I heard from one of my friend that another surgeon friend of mine commented on my transition that it's an unfortunate thing that he changed to her. So it was like, even a surgeon is commenting in that way. I was surprised to see that even a surgeon, actually, surgical science is that much advanced. The transition surgeries, reconstructive surgeries, plastic surgeries, everything is that much advanced. And to my shock, even a surgeon commented this way. I was really, frustrated hearing that. So I think there is definitely a need of unlearning and learning things in the proper way. So coming back to the syllabus, yeah, in Ayurveda in specific, we had some terms in our ancient samhitas regarding this queer identity or gender identity. But I don't think they are all matching to the, the realities. They just give the notion of what existed in our thoughts till now. So I don't think they're perfect in Ayurveda. I think there are some terms specifically mentioned in some samhitas like Napumsaka, Napumsakalinga, or something like that. That is not male or female. Only that is mentioned in Ayurvedic context. Rest everything we learned the same text as mentioned by Ramki. So regarding that, I think the curriculum definitely need to be re-examined and changed. Yeah. Is there anything you want to add me, Ramki?
Dr. Priya, not right now, but if you can still stick around, we may come back with more questions, and I'm sure the audience have a lot of questions for you. But thank you again. Now moving on to Alex. Alex, the point where you stopped was talking about your college and your post-graduation. How was it when you entered the professional life? Did your personal journey of, feeling low at one point, feeling suicidal, and then eventually getting professional counseling, your journey into self-acceptance, what was happening in the professional scenario for yourself? And in general, what is there, when you say workplace, there's every kind of workplace. There may be a corporate hospital where many of the doctors may end up working. There may be the top multinational companies like the one where you are working. There may be also local companies, small scale companies. There could be the unorganized sector, etc. Is there a possibility, it's not, you may not be able to generalize, but could you share some thoughts about what it is for a person to be openly LGBTIQA? Will such a person be recruited? Will such a person be retained? Or if the person comes out in the workplace, what is likely to happen? Alex?
Yes, yes, Ramki. First of all, I have to say that I am fortunate enough to work in a multinational company which is having headquarters in Europe. They are very, they are very positive about it. They want a diverse society. They want diverse culture. Inclusion and diversity is one of the things which most of the MNCs are actually following, which is very positive, I have to say. They actually want more people, more representation from LGBTQ community. The first thing is every people are unique in their own way. And if you need to tap that potential of each individual, which is very important, right? So they are very warm, and they have some of the policies, right? Anti-discrimination policies towards LGBTQ, which is very new. I have to say that even in government sector, right? If you're taking the case of government of India or state government, they don't have that policy of anti-discrimination. And to top it, I have to say that they provide medical insurance for hormone replacement therapy or gender reassignment surgery. They are providing that medical insurance. I don't know about all the corporate. Some of the corporate which are Indian based, right? They have started, tweaking that law, right? Which is positive, I have to say. And they have, and they provide insurance to gay partner also. I'm single, that is different story. But if I'm having a partner, I can have insurance for my partner also, which is not there in the Indian legal system, right? In Indian legal system, husband and wife, they can have that insurance. But in corporate, right, they have tweaked the law to accommodate the gay partner, which is very positive, I have to say. And regular sensitization is happening in most of the corporate, because Indians, we are Indians, and we do have our cultural and social biases, right? And we do have prejudice towards LGBT community. So regular sensitization is happening. And I have to say that when I came out in my office, right, it was very much positive. Some of my close friends, they were very much, they took time. They took time to understand me, but eventually they supported me. And I have to say that most of the girls, right, most of the girls colleagues are very supportive. Guys, they are a little bit, they do have some hesitation talking to me, but they respect me. That is the main thing. Irrespective of who you are, they respect me. That's how it is going on in my workplace, I have to say.
One follow-up question, Alex. You did mention going through depression and possibly suicidal thoughts. How did all of this turbulence in your home life affect your ability to function at work? Did it affect?
Yes, it did affect, because constantly you will be your parents will be one. First of all, you have not come out to your parents, right? So you will get pressure from your parents, and you will not be able to concentrate. I have to tell you that when I was taking client call, my mom called me in between, and she was like telling me, when you are going to get married. I was like, I am going to cut the call. I'm not going to take this call anymore. The very next time I searched in Google, when I was in my workplace, I searched in Google that gay counselor in Chennai. So it definitely affects. Even though I have to say that you will get the financial stability when you are working in a corporate or in workplace, but still that mental pressure will be immense. I have to say, you will be suicidal at one point. I don't know about others. I was suicidal at one point of time, and my work definitely. I work. I love to work a lot, but this. This actually affects your the way you are working.
Right. Yeah. Okay. Yeah. Thank you, Alex, for sharing. My next question to Brinda. This is specifically with reference to persons assigned female at birth. You have already walked us through the concepts of sex and gender. So we know that a person who is assigned female at birth may be a cis heterosexual woman, or a cis lesbian or bisexual or pansexual woman, or maybe non-binary, or maybe on the trans masculine spectrum. But in general, is there something you would like to share about how queer and trans persons assigned female at birth experience the healthcare system, navigating the healthcare system, whether it is for a gynecology specific problem or any other issue? Over to you, Brinda.
Yeah. So as such, the thing is, commonly in at least Indian society, it's a patriarchal society where anyone who is assigned female at birth, independent of how we identify ourselves, right? Anyone who is female is seen as their sexuality is seen to be sacred and all of that. That is on one side. And on the other side, in general, in Indian culture, we don't talk about sexuality, right? We don't talk about sexuality. We don't talk about consent. We don't talk about safer sex practices, or how do you deal with abuse, or even to recognize, to learn to say no. These are all things that we are in general not taught, or we don't discuss about these things. And this also has an impact while accessing healthcare services as well, right? In the sense, because of that whole idea of female body being sacred and all of that, somehow the agency for someone who is assigned female to take for themselves, be it accessing menstrual health services, any sexual and reproductive health services, be it abortion or maternal health or hormone therapy, for trans masculine people to have, I am not very well versed with the medical term, but to actually have surgically remove the uterus. So all these procedures, right? Because it is being done on someone who is assigned female at birth and with female body, to say that they don't have the agency to decide on that. It's like Ramki mentioned one example of, when we go, and this is something I don't know how many of y'all, I know you're all young students. I don't know how many of y'all are personally comfortable, like the female students here, comfortable with actually going to a gynecologist yourself, right? And you're all medical students. And I think that's also a very important thing to then think about, right? Whether you become gynecologist or not, or providing any other sexual and reproductive health service or not, to say, hey, would I go to myself, like, would I be comfortable if a doctor spoke to me like this? Would I be comfortable going to this doctor, right? To find out if I'm sexually active or not, you're going to ask me if I'm married. Marriage has nothing to do with whether I am sexually active or not, because that question takes away a lot of things out of it, right? It's not a queer-friendly question to first begin with. It takes into consideration only sexual intercourse between a cis man and a cis woman, penile-vaginal intercourse that is had after marriage, which means it is going by the assumption that people don't have sex without getting married, which we all know is not actually true. And by like hiding behind a cultural understanding like that, we are taking away from healthcare, right? It's like, as healthcare service providers, I would think your commitment or your like promises to the patient, like the client who comes to you, independent of their sexual orientation, gender identity, caste, class, religion, literacy, all those things, you're just like treating that person, all of your clients equally, right? So when we're talking about now sexuality, like one thing I said about, are you married as a question? Another question is, I told you before also, asking pronouns, right? Based on a person's gender expression, you're not then taking into consideration, like you're not like assuming that a person's gender identity is only how they look, one. And you're communicating to the person that you're queer affirmative, in the sense they have the space to actually probably be have open conversation about any concern that they may have, right? So pronoun is one thing, and also checking with them, right? Not even when you're talking about their sexual practice or whatever, firstly, don't ask whether they're married or not. Beyond that, to talk about even sexual activity, to ask if it is, you know, penetrative or non-penetrative sex would be a better way to ask or talk about it. Because see, penetrative, non-penetrative sex can happen between heterosexual couple and queer couples, okay? Mixed gender, same sex, same gender, opposite. I mean, to assume that an infection might be the result of only penile-vaginal sex is then again is an assumption. The the client becomes probably uncomfortable talking about their sexuality, right? Because you're expecting, say, if it is someone like me, firstly, you will be assuming by how I am dressed that I'm a woman. Then if I'm going to say that I am, let's say at that point of time, my partner is a woman, right? And I don't have penetrative sex, are you going to be judging me based on that? Can I actually openly talk to you about it? Will you be able to still help me with respect to my needs, with respect to whatever concerns I might have, right? Also, in terms of if you're going to be examining a person's body, right, especially female bodies, let's not forget that the general rate of abuse in our country, especially child abuse also, that people go through in India is quite high. Okay, so can we ask, please ask for the person's permission before you're going to do any sort of examination, especially if it's going to be any kind of penetration of sort, right? Please ask for their consent. Please check with them if they are comfortable with it. Make sure, tell them that it is safe, and you know, you will only like whatever as much as they feel comfortable. You're not going to examine anything more. Please understand that as individuals, right, queer people go through a lot of ostracization for who we are already. So for us to come to a doctor to take care of our health, it is a matter of life or death, right? For us, we are put to high level of stigma, discrimination, and shame for our body, right? If you're especially assigned female. And also over and above that, people who may be in the trans spectrum also go through gender dysphoria, where the physical dysphoria might also be there over and above the kind of abuse that we may have experienced, right? So there's so many things at play. Please I only as young medical students, I request that all of you all keep all these things in mind. No matter what kind of medical practice that all of you all go on to do in the future. Thanks, Ram. Thank you. Over to you, Ram.
Yeah, thank you, Brinda. The next question is for 𝗏𝗏𝗃. Can you tell us a little more about conversion therapy? You alluded to it earlier. I also spoke about it earlier, but maybe a couple of experiences that you can share of LGBTIQ young people taken for conversion therapy, and more generally, what is the impact that conversion therapy, I should use conversion therapy within quotes, have on young people?
So there are like a lot of young people here who are listening to this conversation, and it is very important for you all to know about what conversion therapy is. And it is so important for you to know because you have got a lot of unlearning to do. Because before learning about that, because there might be a very good chance like people might teach you, or people who might be into conversion therapy, they might be end up teaching you. You might come across them, I'm just saying. But it is very important for you to know how this thing really works and why they want to do it. So the parents of the queer children, when they find out like their child is different, they want their children to either be a certain way. They always want their children to fit into this binary norms, either like a male or a female, or this person should be a certain way. This is one case. And another case is the child will take the parents to a psychiatrist or a counselor so that they can explain things to them, and they can give an insight about how things are. So when it comes to conversion therapy, they there are like different levels. When it comes, in some ways, if a child or if an young adult has questions, they might guide them in a way. Okay, fine, what you're thinking is wrong, and there is no such thing as this. So you have to why don't you try following this? Why don't you try dating the opposite sex? Why don't you try engaging in a sexual activity with someone if the person says they think they are asexuals, or if the person identifies as asexuals, they might be having questions as well. So this is like the basic level. They might start talking about this. They might start discussing about things like through like general counseling. They might they might be either homophobic or transphobic, or they might be they might have learned things from their superiors, and they end up teaching the same. So this is like the basic level. Whereas electroconvulsive therapy, like, or shock therapy, that's commonly that's the commonly used term in the healthcare field. So that's the thing. It kind of they kind of practice this, and they kind of give them negative reinforcement if they whenever they watch something that they are interested in. And I don't want to get into the exact details because there are like different levels, but these are all the major stuff that they usually do, which will have a negative impact on them. And it is proven that they do not have a positive effect, or or it is safe in general. So they've banned that in many parts of the world, and they are still talking about things like they are still discussing about banning conversion therapy in general, like World Psychiatric Association. I did participate in one of the discussions, and I did get a chance to ask this question, like if they are going to talk about this, have a general law like all over the world where they can ban conversion therapy, because it has negative impact. Even after knowing all this, there are people who still illegally they kind of uh, forcefully do this thing. And that person will end up in a very bad state of mind, because what they're going through is something they did not ask for, and they are very sure about who they are. They'll be very sure about their sexual orientation or their gender identity, but they end up going through this, and it might have an long-term impact on them. So it is very important for you young people to know more about this, and to speak up and ask more questions if they ever talk about this and the methods that they are currently following and the methods that they support. You can ask questions. Why are you doing this? Like, what is the need of doing this? Like, is there any proven, records where, this was successful? Only then you can learn more about this. Only then, though they have made changes in ICD 11, it will take some time to, to bring this into, to talk about this in your, to, bring this in your textbooks or, discuss this in your classrooms. So I do ask you to, get in touch with people in the queer community so that you can learn and you can unlearn loads of things, and you can, it's like it's a long process for you, but you will be in the right direction, because when you finish your degree, it will be easier for the people in the community to get in touch with you, because you will be a queer friendly person, a queer friendly doctor who they can reach out to, because there are only few doctors where few healthcare professionals we can recommend now, where they do all this, they do the right kind of thing by talking to their parents about sexual orientation, gender identity, and stuff. So I wish there are like more people like them in the future, like you all. Thank you. Thank you, Ramki.
Thank you. Thank you, Dwarki. A couple of words about the legal situation. Actually, I have to go back to a term that you would have encountered in your forensic and other textbooks, the word sodomy. Sodomy is typically used to denote anal sex, but even before this, the term sodomy has its origin in the Bible. There's a reference to Sodom and Gomorrah. And this is an archaic concept that got into our medico-legal system during British colonial rule. And there is actually a section of the Indian Penal Code that criminalizes sodomy. The problem with this term sodomy and why you should not be using it is, first, it's not a very specific term. Before, sodomy used to refer to anything that did not involve a penis and a vagina. So anal sex was considered sodomy, oral sex was considered sodomy. In early America, even sex between people of two races was considered against the order of nature and was termed sodomy. But if you look at the legal situation right now, since 2009 in Delhi and 2018 in the entire country, there is a clear recognition within the legal system that there is a distinction between consensual and non-consensual relationships. So just like a man sexually assaulting a woman is a crime, but a man having consensual sex with a woman is not a crime. Similarly, in the case of people of the same gender, or trans and cis people, or trans and trans people, people of the same gender or a trans and a cis person having consensual sex as an adult is not a crime. So it is not illegal to be LGBTIQ. But this actually got firmed up with the 2018 verdict of the Supreme Court in the 𝗷𝗵𝗂𝗂𝗃𝗃 case. More recently, on June 7th, just earlier this month, Justice Anand Venkatesh in Madras High Court said not only should conversion therapy be banned, but any doctors or mental health professionals who are practicing conversion therapy should have their license revoked. So this is the first time in the history of India that there's actually a judgment talking about banning conversion therapy. There is a current case in the Kerala High Court saying that conversion therapy should be banned, but action has not yet been taken on that. Okay, now a quick time check. It's 7:50. I've been told by Harini that we have 6 or 7 questions. So before we get to the questions, I'm going to spend 4 to 5 minutes sharing with you a video. This video is basically on how a queer affirming doctor should deal with a client. And it presents 2 scenarios. One is a doctor who doesn't know or think about LGBTIQ issues. And the second scenario is the same doctor who does understand these issues. So just bear with me as I share my screen and play this video. A little bit of context again. This is a video that was put together by a bunch of LGBTIQ groups in the country of Uruguay in Southern America in partnership with UNFPA. And it's intended as a didactic tool to train doctors.
Alejandra Pérez. ¿Qué tal? Buenas tardes.
¿Qué tal, doctor?
Toma asiento. ¿Edad?
32 años.
Bien. ¿Por qué motivo consultas, Alejandra?
Vengo a pedir el PAP.
Bien. ¿Estás en pareja actualmente?
Sí.
Bien. ¿Y qué método anticonceptivo usás?
Ninguno.
¿Tenés hijos?
Sí.
Bien. ¿De qué edades?
Uno de 2 años y otro de 8.
Bien. Bien. ¿Cuál fue la fecha de tu última menstruación?
Ayer.
Ujú.
Ayer me vino.
Bien. ¿Pero generalmente tenés ciclos regulares?
Sí, sí.
Bueno. No te vamos a poder revisar porque estás menstruando, ¿sí? Lo que sí te voy a hacer es la receta para el PAP, porque ya hace más de 2 años que no lo hacemos, ¿no? Lo que también voy a hacer es, te voy a dar una receta para las pastillas anticonceptivas, que son las que dan acá en farmacia. ¿Ah? Y si no, lo que puedes hacer también ahí es pedir preservativos, ¿sí? Bueno, a menos que quieras ir por el tercero. Bueno,
Gracias, doctor.
por favor. Pérez. ¿Qué tal? Buenas tardes.
¿Qué tal, doctor?
Toma asiento. ¿Tu nombre?
Alejandra,
Alejandra. ¿Qué edad tenés, Alejandra?
32 años.
32. Bueno, ¿por qué motivo consultas?
Vengo a pedir el PAP.
Bien. ¿Mantienes relaciones actualmente?
Sí,
¿Estás soltera, en pareja, con múltiples parejas?
en pareja.
En pareja. ¿Con un hombre o con una mujer?
Con una mujer.
¿Y tus parejas anteriores fueron siempre mujeres?
Salí antes con varones, pero ahora salgo con mujeres, sí.
¿Vivís actualmente con tu pareja?
Sí,
Sí. ¿Tienen hijos?
sí.
¿Son tuyos, de tu pareja o adoptivos?
Son adoptivos, los adoptamos juntas.
Mira. ¿Y qué edades tienen?
2 y 8.
2 y 8. ¿Alguna vez estuviste embarazada, Alejandra?
No.
Bien. Bueno, venías por el PAP, decime, ¿te habías hecho uno anteriormente?
No. En realidad, doctor, nunca vine al ginecólogo. La cuestión es que ya van 3 veces que me hago el carnet de salud porque se me vence cada 6 meses. Por eso de que me tengo que hacer el PAP y temo que me duela. Incluso mi pareja tampoco se ha hecho nunca el PAP.
Bueno, no te preocupes, yo te voy a dar la orden para el PAP. Es una técnica sencilla y que no duele, ¿sí? Son unos segundos y es una manera que tenemos para ver si tenés alguna infección o si está todo bien, ¿tá? Es importante para prevenir el cáncer de cuello de útero. Decime, ¿cuál fue la fecha de tu última menstruación?
Y hace 10 días. Bueno, de hecho le iba a decir que estaba menstruando en estos momentos porque me aterra el tema de la revisación.
Sabes que es importante que te hagas el PAP, ¿ah? Es una manera que nosotros tenemos de detectar lesiones premalignas o malignas de cuello de uterino, ¿tá? Que generalmente vienen por una infección de 𝗵𝗵𝗿, que también es una enfermedad de transmisión sexual, ¿tá? Yo te voy a dar lo que es la receta para el PAP y también te voy a dar un folleto, ¿tá? Que explica cómo hacer una barrera de látex y tiene otros consejos para mantener sexo seguro entre mujeres, ¿tá? Servite.
Bueno, gracias.
Por favor, que tengas buen día.
So this is the end of the video clip. Compare the 2 scenarios and the diagnoses made in the encounter 1 on the left and the encounter 2 on the right. Assumptions regarding the woman's sexuality, sexual history, birth history, and what is being recommended. All of them differ, or many of them differ. So in the first case, the doctor just assumes the woman is heterosexual. She has come for a pap test. She says that she has had previous gynecological appointments. She says that she is in a stable relationship, though he does not ask, but assumes that it's with a man. She claims to have regular cycles, 2 pregnancies and 2 births, which the doctor infers when she says she has 2 children. And he asks her about birth control and she says no. The reason she's not on birth control is she's actually with a woman, but there's no scope for him to infer that because he went on with his assumption. She claims to have had a pap smear 2 years ago. And because she claims she's menstruating, the doctor does not do a physical examination and basically recommends contraceptive measures like ask very open-ended questions like, are you in a relationship? Is it with one person? Is it with multiple people? with whom then are these children your children or your partner's children or adopted? And then when he moves on to asking about the pap test and so on, the woman is much more open and ready to divulge her relationship and sexual history, and leaves with a counseling for cancer prevention for the and also a brochure on safer sex among women. So I'm going to stop sharing the video. Sorry, would people from the panel or people in the audience like to reflect on either the video or what the panelists so far have shared? And do you have any comments or questions? It's going to be 8 o'clock now. We have sufficient time. This was scheduled until 8:30. So feel free to reflect on the video or on what the panelists said, including panelists who'd like to respond to each other. Please go ahead. You can just unmute and speak.
Hello, am I audible, sir?
Yes, Kaushik. You can
sir,
also turn on your video if you like. Yeah.
Yeah. Sir, we sent a Google form asking questions whether asking the participants whether they had any doubts regarding the LGBTQ community and regarding everything about the community, sir. So we have a number of questions here. I'll start now. Do you think legalizing homosexuality alone will help the LGBTQ community? What other changes do they expect from the government or society? They're asking.
Okay. I'm just going to say one point right now, that you should distinguish between homosexuality and marriage. Homosexuality is no longer illegal, but a marriage may be is not recognized by law. So the person who is asking the question, were they asking about marriage or were they asking about homosexuality? Because homosexuality is not illegal.
Yeah, but I think they don't know about that. I think
okay. Okay.
So,
but in general, maybe we can assume that they are talking about legal changes and what besides legal changes are needed. Would anyone like to go? Alex, Dwaraki, Brinda, Dr. Priya? Go ahead, Alex. Yeah.
Yeah. So the question was, I think legalizing same-sex, relationship or marriage or something like that is very much important, I have to say. It actually gives the identity to the gay couple. But I have to say that that kind of representation should come from the society. Government will legalize everything, but if the society is still not ready to accept that relationship, it will be one-way road, I have to say, in that aspect. But I have to say that most of the corporates have, given representation for a gay partner. They have given that medical insurance. I am not sure. I don't think there is any medical insurance for gay partner or LGBTQ partner in central government job or state government job. But most of the MNCs are. Most of the MNCs which I know are taking that step, which is very positive, I have to say.
Right. They do it through their own internal policies. But since the law of the land does not recognize their relationships, what the employees are presenting is just a statement of declaration that they are a couple. They don't have a marriage certificate. But the broader issue, I think, is legal change in the positive direction enough? Or does there also need to be other elements of change, like social change, for example? Would any of the other three panelists like to add to what Alex has shared?
I'd like to add something, Ramki. I think first, decriminalizing homosexuality was very crucial, very important, because for two consenting adults to involve in sexual relationship was criminalized. Now that required definitely legal validation in terms of decriminalizing. One. Two is with or without legalizing same-sex marriages, there's so much more that needs to be done. And even let's say a law comes up tomorrow that saying that, just like heterosexual couples, same-gender couples can also get married. Their marriages are going to be recognized. and we will have marriage certificates, it won't be enough. Like, because will government officials actually register our marriages? Will they actually, because that is happening with respect to trans people's gender change process as well. There's a law that's there, there is process in place, and still government officials in many ways, that's at the level of the policy level and at the level of advocacy on the ground, right? Changing people's perceptions. It's not enough that it changes in the law, which is also why we are having this conversation with young medical students, right? Because the attitude needs to change and shift and say, you know what, this person wants to get married to this person or identifies themselves as this way. Nobody else can say yes or no to whether that person can be identifying themselves that way or want to spend their life with a specific person. So that's the thinking that needs to change, right? So it's not just about a law. Law is very important, but it is like really never sufficient.
Just to add, since 2018, there have been many cases where young couples saw that the Supreme Court, had delivered this judgment, and they became very bold and courageous to come out to their parents, saying that, this is my girlfriend, we are a lesbian couple, etc. And many of them have faced horrific violence at home, with being kept under house arrest. In some cases, they've been physically and even sexually assaulted. And we know a lot of people who have tried to run away from home. And this entire situation got even worse with COVID, where because of lockdown and loss of employment, a lot of people had to go back to their homes, where this kind of violence, resumed afresh. Okay, Kaushik, you have your next question. Then maybe we can ask Priya and 𝗏𝗏 to respond to the second question in interest of time. Go ahead. Yeah.
How to support a friend who's coming out to me, as like personally, how to support a friend?
Yeah. Can we ask Dr. Priya first and then 𝗏𝗏? Priya, are you there?
Yeah. Am I audible?
Yes, yes.
Okay. See, how to support a friend who is coming out as queer or trans or lesbian, gay, whatever. It's like, till yesterday or till the moment they came out to you, what was your attitude towards that girl or guy or whoever? It should be the same the very next moment. The very next moment after they comes out to you. So that is the way we expect to be, but in reality it's not the same. See, when we come out without any plannings or impulsively, when we come out to our close friends or relatives or whoever, we expect them that they would understand our feelings. They would give their shoulder for us to hug, but when the opposite happens, it would be a big heartbreak for us. So it's like you don't need no need of any sympathies or oh, you are a queer, you are a trans, you are a gay. No need of any sympathies or any specifications or taglines. We just want ourselves to be taglined as yourself or your friend. That's enough. See us as your friend. Don't give any taglines or any special considerations. Yes, obviously we want some special considerations in social regards, but not in our friends, not within our friends. We just need to be considered as as yourself, yeah, as a friend. And by the way, I forgot to mention, Alex is one of my friends. We met in one of our seminar during my pre-transition time. And hi, Alex, I forgot to mention that.
Hi.
Okay.
It's been 1.5 years, I guess. Yeah.
Yeah, 1.5 years. So we'll continue with the talk.
Thank you, Priya. 𝗏𝗏, do you have anything to add with what Priya has just said? But if so, please unmute yourself.
Priya did mention everything perfectly, but the main thing that you have to do is listen and, try hearing them out, because it's a very emotional moment for them. It's not something It's not something spontaneous. They plan everything in their head. They want to make sure everything goes well. And they'll always think about, okay, fine, the negative scenarios. Okay, fine, what if this person doesn't accept me? What if this person doesn't love me as they used to? So just be there, listen to them. You can ask questions. I mean, you can initiate a conversation like how I should address you as, what are your pronouns, or that is very important, like acknowledging that, should I address you as he or she or they, that is super important. You can ask questions, and yeah, just listen. That's all they want. And yeah, the main thing is, need not change your attitude just because, you need not walk on eggshells just because, that person came out. Or just also on a lighter note, just don't try setting up them with someone, some other gay person that you know, or some other queer person that you know, because that might be an uncomfortable thing. But yeah.
Yeah, I'm going to add, don't also immediately assume that it's only about sex and then get into asking about who they did with, what they did with whom, because sex is just one aspect of it. There's so much more, just like for straight cis people. So don't make it only about sex and sexual behavior. There's so many other aspects to an individual's orientation or identity. Okay, over to you, Kaushik.
Yeah, the next one is, how can I, a medical student, stand up against people who speak ill about the community in general?
Yeah, in general, meaning not in the professional context or just in society?
I think in society, both actually.
Yeah, okay, it could be both. See, as a doctor or as a medical student and an aspiring doctor, you do have access to the latest medical and scientific information. You may not find it in your textbooks like we pointed it out, but you just have to go to websites like the World Psychiatric Association, the World Health Organization, etc., the American Psychiatric Association. You'll find a lot of information. There are also community-led run websites like orinum.net, which have a lot of information. So I think approach this from a scientific perspective. As long as you are able to understand yourself that this is not a pathology, it's not a psychosocial disorder. And from the other angle, that we are just talking about humans, flesh and blood humans with the same emotions as everyone else. I think you should be able to stand up to negative remarks. And if you encounter these negative remarks, even in the professional context, you ought to be able to, quote WHO on them or APA on them. Okay. Would anyone else like? Yeah, I think you can. Yeah, please go ahead. Yeah.
What measures can be taken to maintain the health of bisexual women? Sexual that's physical health. I think this is kind of a personal question.
Okay. Brinda, before you go, can I just jump in one thing and say one thing?
Please say more than one thing also, Ramki.
Okay. Don't assume that a person, so bisexuality is really about orientation, who you're attracted to. So don't assume that a bisexual person is hopping into a bed with a man one night, a woman another night, and will not rest in peace until one has had 50% of one and 50% of the other. So there are people whose sexual orientation may not be limited to one gender, but their relationship may be limited to one person who happens to be man or woman or non-binary. So whenever you see a man and a woman, you think, okay, they are in a heterosexual relationship, but actually, you can't assume that they are both heterosexual. One or both of them could be bisexual. Similarly, if you see two men together, you can't assume that they are both gay. One or both could be bisexual or pansexual. Similarly, if you see two women together, you can't assume that they're lesbian. One or both of them could be bisexual or pansexual. So step number A, the orientation is not as important. If you're talking about questions of sexual health, please realize that sexual health and sexual behavior may not be congruent with sexual orientation. So if you really are somebody who's physically active with men and women, or with multiple men or with multiple women, be aware that there are STIs that can be transmitted between people with female parts, or from a person with male parts to female parts, between people who are pre-transition to people who are post-transition, etc., etc. and address the issues of safer sex, regardless of who they are having sex with. So if they're having sex with somebody that has a penis, yes, you need to take a few precautions. If you're having sex with somebody who has a vagina, they may still be using penetrative devices. They may be using strap-ons or dildos or whatever, where also the issue of safer sex and needing to use condoms comes into play. So just don't go by how they define themselves as bisexual or gay or straight or whatever, but you just ask respectfully questions about their sexual behavior and about what precautions they take. And regardless of whether they are bisexual or heterosexual or homosexual, you talk to them about safer sex and what the precautions that need to be taken are, like they talked about dental dams in the trigger video. Brinda, over to you in case you'd like to add.
I have just one small thing to add. I think you had also mentioned mental health along with sexual health, right?
Yes.
So in terms of mental health, it's very important when you say bisexual women. A lot of times they may say that I'm bisexual, they may say I'm pansexual, may say I am queer also, but maybe bisexual. So here's the thing, right? Very, very important thing is, I'm not answering this or saying this to like medical professional students. I am actually telling this as people. Don't assume that a person who is queer will immediately, there's a lot of making fun of women, or there is a certain voyeuristic thinking because of porn that they will be open to threesomes, and there's a certain kind of other kind of thinking which is like even within friends to mock and make fun of. And if you're getting into a relationship with a queer woman, don't assume that she would be open to a threesome. Queer being, their sexuality is their sexual preference, right? And whether or not they will be open to a threesome or not, or whatever, more people or not, multiple partners, that's a matter of consent in a different way altogether. And I think as individuals, we need to start respecting people's choices as well and their orientations. And that also goes on, then gets carried on to professional spaces as well, right? Because that prejudice comes in for us otherwise. That's the only point I wanted to add. Thank you.
Kaushik, go ahead.
So how can we be helpful towards LGBTQ-owned businesses? How do we contribute to LGBTQ-owned businesses in general?
Businesses, 𝗏𝗏𝗃. Somebody's mic is muted. Could you please... someone other than the speakers is on... I think Kaushik was saying businesses, 𝗏𝗏𝗃.
Yeah.
LGBTQ businesses.
Okay. Sorry, I didn't understand the question. Please repeat the question.
How can we be helpful towards LGBTQ-owned businesses?
Or to LGBTQ-owned businesses, other than shopping there? Yeah, anybody would like to answer? Alex, Dwarki, Priya, Brinda. How can
LGBTQ,
be helpful to
how can we be helpful to LGBTQ businesses, right? I'm not, I don't know. You have to support, the way you are supporting heterosexual people, you need to support the same way. I'm not asking for any extra preferences. Yes, for transgender, you do need to help them in some way. I'm not asking for any extra preference or extra treatment, but definitely you should treat that individual as same. That is the only thing which I feel. I may be wrong or something like that, 𝗏𝗏𝗃.
Right. No, I agree with you. I think that historically, the LGBTIQ community, the people who have been more marginalized are maybe the people who are visibly more different. And historically, I think, at least in the Indian context, I think trans women have been more visible and the target of discrimination because of that. So I think, and have not had the opportunity to have the same kind of education and training and professional opportunities that non-trans people have had. So definitely supporting trans-run businesses. Trans men have had a different issue, which is very often they are invisibilized. When you see transgender, when you hear the word transgender, you think of people who are assigned male, who identify as women or as quote unquote third gender, but you don't think of people who are assigned female and who identify as men. So I think that the issue of invisibility has to be addressed. And if there are actually trans men owned businesses, also try to make an effort to support them.
Okay. The next one is difference between sexuality and gender identity. I think this one has been answered a lot of times in the session.
Yeah.
But can you again?
Okay. Sexuality is basically related.
Ramki, we can't hear you.
Yeah, we are not able to.
I think Ramki's screen has frozen.
Network bandwidth is.
Yeah, maybe.
Okay.
So Brinda, can you explain that?
Yeah, so like mentioned earlier, sexuality is essentially who we are attracted to, right? Gender identity is how we identify our gender as. Now, gender identity does not correlate or relate to a person's sexual orientation. I may be non-binary and I may be attracted to a cisgender man, a trans woman, a cis woman, or anyone in the trans spectrum. I might be a cis man attracted to a cis man, a trans man. I might also be attracted to a cis woman, a trans woman. So my gender identity has nothing to do with my sexual orientation in that sense. And even in terms of sexuality, it's self-identity, right? Bisexuality does not necessarily have to be only a cis man and a cis woman, that I'm attracted only to a cis man and a cis woman. It might also be that I say I'm attracted to a man and a woman, which means I'm attracted to both trans men, cis men, trans women, cis women as well. So it is clearly, even sexuality is self-identification. And I might also identify myself as asexual. I may be a cis woman and asexual, trans woman and asexual, non-binary and asexual, cis man and asexual. So asexuality is also a very valid sexual orientation, and that's also an important distinction to keep in mind. Thanks.
Okay, while I have you, there is another question regarding pronouns. How do we address people with correct pronouns? Yeah.
Ask for their pronoun, and it's that simple, right? Like in the video that we saw, for instance, the doctor asked who is your partner, right? Same way, while you're asking like that, ask for the person's pronoun also. I would think that's one more question to add as well. And a person's pronoun does not necessarily give their gender identity also. It is just their pronoun. I mean, that's also the other thing. Like someone who says like me, I am out and I'm saying my pronoun is they and them, and I say my pronoun is they and them because I identify myself as non-binary. A person might say, you know what, I don't I identify myself better with the pronoun they and them, although I identify myself as a woman. There can someone, like people can also say that it's really a matter of self-identification. So just ask and don't assume, right? A lot of times. And that is also, I understand the problem lies in the fact of we think respect, it's respectful to say sir and ma'am, Like for me, I was not comfortable with being addressed as ma'am because I don't identify myself as a woman, right? And my pronoun was they and them there. So these are all some things to keep in mind when we talk to people.
Do people from the community have special reservation for jobs, or how will it impact if they have any?
There is no reservation for LGBTIQ community, but in 2014, the Supreme Court of India said that they should be considering transgender people as socio-economically marginalized groups and make people eligible for reservations. But that hasn't happened in any state other than, I think, Karnataka, Tamil Nadu, and possibly Kerala. Dr. Priya, can you clarify about Kerala, whether there's a reservation?
Yeah, am I audible?
Yeah.
Yeah, in Kerala we have reservations for transgenders, but I don't think for LGBTIQ other communities there is no reservations. But for transgenders there are reservations in certain aspects, certain scenarios, not in every field, because trans visibility is now coming up, not to the fullest extent. So I think situations are changing. We are getting more spaces to express ourselves. We are getting more visibility. So I think in Kerala, it is like in Kerala, definitely they introduced a trans policy, and they're executing that. We have a social justice department that is very much functional and very active. So yeah, here conditions are very good for transgenders.
Yeah, I think that's about it, sir. I think questions are done.
Thank you. Please unmute yourself.
Yeah. Is there anyone from the audience who has not sent in their questions before, but wants to ask or comment or reflect on today's session? We're nearing the end, so we just have room for closing comments and reflections. Harini, you have your camera on? Yeah.
No, sir. I was just, we have a person waiting for the vote of thanks.
Okay.
Yeah.
And if any of the panelists have closing points or closing remarks also, please go ahead. Dr. Priya, Alex, 𝗂𝗏𝗏, Brinda.
Am I audible?
Yes, please go ahead. Yeah.
Yeah, I wanted to tell just a few things. It's like, my news, like almost from last January, it seems, my news was getting viral in Kerala and some other parts of the nation. So I was getting, during my transition, I was really confused. I was really scared. I was thinking of dropping my profession. I was thinking of looking into, some other courses, safer zones for transgenders that would be more safer for transgenders. So I was even thinking of that. But when I came out to the society, proclaiming myself to be a trans woman, things were very different. I was getting more positive responses. And right now, I'm being invited to many colleges, medical colleges, engineering colleges, everywhere. They are inviting me in a Queer Club for this Pride month. And I'm really happy, to know these facts. Actually, I couldn't even imagine to express myself during my college days. And now each and every college here in Kerala have Queer Clubs, and they are giving more positive knowledge. They're giving more sensitization classes and programs. And it's all like, we are moving in the positive direction. And I'm so much happy for that. And I'm very happy to take part in this session also. Thank you, 𝗏𝗏𝗏, for this. Thank you.
Thank you. Alex, 𝗏𝗏𝗏, Brinda.
Yes, I wanted to say. First of all, I would like to thank all the doctors. You all are going to be future doctors, right? taking your time to understand the LGBT community is a very big thing, because you will be the torch bearers of the healthcare sector and mental health also. So I would like to thank you all for taking your time. Thanks.
Yeah, I'd like to just add one last thing, which I feel like I missed also. Firstly, thank you so much for organizing this session. And as young professionals, students being open to actually learn about the LGBTIQA+ community while you're in college itself, right? I mean, wish like generations before had also done that. It would have really helped the community. Just one thing, please be aware that, apart from people assigned female who identify as women, there are non-binary people, trans-masculine people who also are in need of menstrual health, menstrual and, gynecological services and support as well. So please, like, there are resources available, and we would be happy to talk to you more about it. I think more conversations need to happen about that also, because especially for persons who actually go through physical dysphoria in terms of their gender identity, menstruation becomes a real challenge as well. So that is just one more aspect I thought I had to mention before we close. Thank you.
Thank you. 𝗏𝗏𝗃, any quick comments?
Yes, 𝗏𝗏𝗃. Thank you everyone for listening to this conversation, and I would like you all to ask more questions in the future, like with your professors and whatnot. Just I know that this is Pride Month, and people do want to learn about this. Ask questions and learn about the community throughout the year. Keep this conversation running so that you can learn more about the community. And when it comes to mental health, it is very important, because people in the community and their parents, everyone is, they do want to have a conversation. They do want to understand more about this. So I hope, as young doctors, I wish, you all learn more about this and, help, or, be keep the community, be an ally, and, be queer friendly. Thank you.
Thank you, 𝗏𝗏𝗃. A quick note, my colleague from Sati, 𝘂𝗵𝗃𝗃, is here, who is also a trained peer counselor. So Leo, if you can put on your video and say hi, and also type in your email address and helpline phone number. And I will also request 𝗏𝗏𝗃 to type in your email address, and then I'll give a phone number that people can reach out for help. So Leo, can you just quickly put on your video, say hi, and type in the helpline
Hi,
number?
yes, I will do that. Just a minute.
Okay. Tell us a little bit about yourself.
Hi, nice to hear from all of you, and it was a really nice discussion. And myself is 𝘂𝗵𝗃𝗃. I am a cisgendered gay man and staying in Delhi with my partner and working with Sati in the Samatha project. So this is also an LGBTQ project where we are working for the LGBTQ community, involving the Delhi NCR as well as the other parts of India on the rights as education and health, legal aspects, socio-legal health. We are doing all those things. And also the workshops we are organizing in colleges and universities and within the community. So I'm going to type the helpline and the helpline email number in the chat box. Thank you.
So if any of you have questions of a more personal or counseling related nature, feel free to reach out at the email addresses or phone numbers that we're typing in the chat. And Harini, over to you while we do this. Or whoever else is,
Yeah, we have Deepshika to end with a special vote of thanks. Deepshika is available.
Hi, am I audible?
Yes, please.
Hi, all. I hope it was a very warm evening to all of you over here. I deem it a great privilege to say the vote of thanks on this event. To begin with, I would like to thank all our panelists who spared their time from their schedule to grace this event. Thank you, dignitaries. I would like to express my gratitude to Dr. L. Ramakrishnan sir for coordinating with us so well to help and organize this event. Next, I would like to thank my colleagues and friends for their guidance and encouragement in all our efforts. Last but not the least, I thank the audience for the questions and the cooperation for wanting to provide an inclusive healthcare to our society and making this event a resounding success. Thank you all.
Also, just one final point. Several people have messaged me privately asking for the link to the video that I shared. That's actually one of a four-part video. I don't have the link with me right now, but if you can email me, I will send you the video link. I'm going to type in my my email address below as well. And it'll be great if you use it for other training programs. So anything that we have shared here, whether it's a PowerPoint or a video, is free for you to use. Just let us know. Okay, great. Thank you.
Thank you.